EMTT is part of our regenerative suite because it's perfect for folks who have chronic, long-standing conditions that never seem to clear or go away and that are difficult to get relief from. And so while EMTT doesn't necessarily guarantee that it's going to take away all of your pain or discomfort, but what it does do is give you a jump start and give you a step ahead of where you have been in the past, but that some of the more traditional therapies will have better effect. What we've noticed with a lot of our patients with any kind of chronic joint pain, arthritis, any kind of tendonitis, whether that's tennis elbow, golfer's elbow, low back pain, greater trochanteric bursitis, or hip pain, this side of our hip pain that kind of comes down into our thigh, any of these kind of chronic, long-standing, never seeming to go away, and you've tried a lot of things that haven't worked or given you sustained relief, we really like to incorporate EMTT for those situations that give us that jump start, give us that next level edge of recovery and improvement that allow for our more proven therapies to have the best chance at success. My name's Dr. Nick from Preferred Physical Therapy, where we specialize in helping folks just like you stay active and independent, live free from painkillers, and avoid surgery. EMTT, or Electro-Magnetic Transduction Therapy, works by facilitating the movement of oxygen nutrient-rich red blood cells into areas of pain and by helping them clear from the area of pain. Red blood cells are like the mules of the body. They're the ones responsible for carrying all the oxygen and nutrients necessary for tissues to heal, as well as gathering all the leftover things like inflammation and dead cells that need to be cleared and removed. So picture your blood vessels like a freeway. Multiple lanes of traffic that allow for a lot of movement. What ends up happening is those blood vessels then begin to narrow to merge into a single lane of traffic. And when you do that, we get a lot of congestion, particularly in an area that's requiring a lot of activity. So we have a lot more congestion, like rush hour traffic, that's trying to get to the area, but it can't because it narrows down to a single lane. EMTT allows for a faster flow and a faster circulation of those red blood cells to get through, to deliver the oxygen-rich and nutrient-rich material, and then clear all the inflammation and dead material, which in the end facilitates healing and allows for the healing process not only to be faster, but to be more effective, to get you relief more quickly. Many of our patients will get up off the table feeling 50 to 70% better just in one session. One of the devices that we use to treat lower back pain is called EMTT, or Electro-Magnetic Transduction Therapy. EMTT is part of our regenerative package. What's unique to EMTT is its ability to improve the cycle of red blood cells to the area. And this is important because red blood cells are the cells in blood responsible for carrying your oxygen and all your other nutrients to help improve healing, as well as gathering all the dead tissue, all the dead cells, and clearing it out. So it's our transport system. What happens is we get congestion at an area of injury, causing a slowdown of that recovery. And even worse, under chronic conditions, is that slowdown is much bigger. Imagine going from a wide lane freeway and then having to merge into a single lane track. That's what happens with red blood cells, is they go from large blood vessels and then narrow down into a capillary. Capillaries functionally are the single width of red blood cells that line up in single file and then march through. So the faster we can get those red blood cells to move through those capillaries to improve healing, the better. And that's what EMTT does. What's great is you don't feel anything with it. You might feel a little bit of a buzz, a little bit of a tingly sensation, kind of like a static charge feeling, but otherwise you don't feel anything. Additionally, you don't have to take any kind of clothes off in the area. You don't have to expose skin. It can go right over top of that area. Folks who this device is not appropriate for are those who have any implantable electronic device. So whether that's a pacemaker or a spinal stimulator, would not be a good idea to use this. Alani is our patient today, and she's having some back pain. This could be on one side more than another. And so Alani, indicate to me where your back pain is. So we're going to place the circle right over top of it. It does not need to be touching her skin. It can be, but it doesn't need to be. Perfect. And so you're saying right in this area here. Perfect. We double check and make sure that there's no metal belt buckle or anything that might cause some disruption to the device. And then we simply turn it on and you're going to hear a series of clicks. In this case, we're going for 8,000 pulses. And every time you hear a click is a pulse. It'll look and sound like this. This will go for about 15 minutes. or until the 8,000 pulses are up, and then she'll be done. So this can be a standalone treatment, meaning you come in just for this. Additionally, we like to pair it with our shockwave device. Doing this prior to shockwave allows that tissue to be highly recharged and improve the amount of rich oxygenated blood we get to that healing area. You can learn more about our regenerative package on our website. We'll put the link in the description below. The conditions of lower back pain that we've seen respond really well to this are any kind of chronic low back ache. So the folks who either are highly active or sedentary, but just consistently have this low-grade, low back ache that never seems to go away no matter how much physical therapy or exercise or chiropractic adjustment or any kind of medication. They just have this low back, low-grade ache. Folks respond really well to this. The other kind are those more of an acute nature. You did landscaping all weekend, you deadlifted wrong, you did something that now triggered a low back event, and it's now painful. This does a really good job of reducing that pain up to 70% within one session, and then with a few more treatments, can nearly eliminate that acute low back pain event. What we love about this device is it's a non-invasive way to help you stay active and independent, living free from painkillers, surgery, and injections. If you're curious about whether or not EMTT will work for your condition, give us a call and mention this video for a free trial session.